Here's a little diagram showing the difference between bipolar type 1 in the top and bipolar type 2 in the bottom. As you can see, the bipolar type 1, they both 1 and 2 have major depressive episodes, but in bipolar 1, they have a manic episode. Their mood's going up way higher and causing a lot more significant impairment, where in bipolar 2, they just have the hypomanic episodes. Here's another graph showing when psychotic symptoms might come in the different bipolar 1 at the top and bipolar 2 down below. So you can see in bipolar 1, they have these manic episodes, and this patient here, he had a manic episode, and he didn't experience any psychotic symptoms. And then he came back down, and now he's euthymic, and his mood is fine. Then he goes back up, and he has another manic episode, which, remember, has to last more than 1 week, or any length of time if there's hospitalizations. So he's manic, but this time, the red dots indicate psychotic symptoms. This time he had psychotic symptoms with it, which is fine. And that means he still has bipolar 1, because in manic episodes, you can have psychotic symptoms, and it's still bipolar 1 as long as they go away when the patient gets euthymic, and it looks like they did. And then here, look, he gets depressed, he has a major depressive episode, and he has some psychotic symptoms there too, which happens sometimes in patients in the middle of a major depressive episode. And then the psychotic symptoms go away, and then he gets manic again. Alright, versus bipolar 2, where he's having a major depressive episode, and he could have psychotic symptoms here, but this patient didn't. Then he's euthymic for a while, and then he goes up to hypomanic for a while, for at least 4 days, no hospitalizations. And then he goes back euthymic, and then he has another major depressive, but this time it's bad, and he has some psychotic symptoms. He gets treated, they go away, and he turns back into normal euthymic. Again, remember this diagram from the psychotic disorders lecture. You have schizoaffective disorder on the top and bipolar on the bottom. Just to remind you the difference between the two, that schizoaffective has psychotic symptoms this whole time, and they have this mood. So this person's getting manic or hypomanic, now they're euthymic, and now they're depressed. But their psychotic symptoms are always there, even when they're euthymic. And they have to be there for at least 2 weeks, as per the DSM. Versus bipolar, where they only have them in these episodes only. Here's another diagram showing bipolar 1, bipolar 2, and cyclothymia. You can see bipolar 1 gets higher manic episodes, and they get depressed. Cyclothymia is less, and less hypomania, less depressed symptoms. Bipolar 2, they get as depressed, equally depressed as bipolar 1 patients, but they only have hypomania.